complications can arise from an MPN during pregnancy?
Well, look, I mean, pregnancy, here you have two things. One of them common and complicated, and the other one uncommon and complicated. So common is pregnancy, but every pregnancy is different. And, there's a lot of changes going on in the body. And there's certain risks that can go along with that as well. So clotting risks sometimes can be increased in pregnancy. And then you have an MPN where you have a clotting risk on top of that. The pregnancy really changes what kinds of medications we can think about using. And so, there are certain medications that we use comfortably in patients that would be an absolutely forbidden medication in a pregnant woman. And so it depends a little bit on what's going on with the patient. But if they have a history of clotting, then certainly we would think about wanting to control their blood counts. Depends a little bit on what the disease is, how we would do that. Interferons are commonly used in pregnancy, and they are safe in pregnancy and can improve the outcomes in some patients with pregnancy. But short of that, in patients, for instance, who are at very high thrombotic risk, sometimes we have to sort of balance the risk of having a clot and something that can interfere with the pregnancy and the risk of bleeding. So it's not uncommon that people are on blood thinners during pregnancy at some point. But it really depends on the individual patient. What we do here is we keep very close contact with the patients. And, all of our patients are seen by the high-risk OBGYN. So it's not the general obstetrics people who are monitoring their patients. So they're much more closely monitored and for complications of pregnancy. And we are seeing them more frequently during pregnancy to help from the MPN side to try to optimize and minimize the risks of clot. And that doesn't end as soon as the baby's out. There's in breastfeeding, the clotting risk is not normalized after pregnancy as soon as the baby comes out. And so, there's a adjustment for several months afterwards where we're still kind of thinking about this person a little bit differently than we would if they were not or had not been recently pregnant.